try and draw out some, I think, themes that we've been talking about today. I don't think this is a comprehensive summary by any means, but I think in a nutshell, it seems there's still quite a good deal more to do to prevent and support organisations like Midstaffs. There are some people that feel optimistic that we're going in the right direction, others that are still probably feeling that there's a little bit more negative. I suppose on the good news, we heard from Nigel that in the NHS, boards are now focusing more on quality and safety and patient experience, but they've got some way to go to establish a culture that makes that automatic and a core focus of their work. Second point is that I think both Anthony and Nigel highlighted, and I promise you they hadn't colluded on this, characteristics of failing or troubled organisations. And we know quite a bit about what those characteristics are. But the NHS is still not good enough about spotting the early warning signs and then dealing with those organisations in a proportionate way. We heard that with the regulators, there is a real risk that their tractor beam gets focused on those failures, but only in a way that is trying to mitigate or limit their own risks rather than providing a space for those organisations to improve, or even giving them practical tools in which to do it. So some work to be done there. We talked quite a bit about a culture in which staff are supported to provide better care, and we had a variety of things, whether it's working in multidisciplinary teams, appraisals, the Schwartz rounds that Jocelyn talked about, offering people the chance to debrief, lots of things that need to be done, and organisations should be encouraged to choose whatever method works for them, rather than it being some sort of prescription for the whole of the NHS. We talked about the things that help organisations to establish a culture of learning and improvement, and we've talked a lot in that last session about both the choices about what the board chooses to focus on, but being authentic in following through. We've also talked about, in this last session and previously, about having the right targets, that it's not acceptable to have targets that mean that some people might die as a result. And we've got to get stronger at having a zero tolerance of things that harm patients, and being clearer about zero tolerance in organisations around the behaviours and contributions of individuals. This morning we also heard the theme of isolation and disconnection in a variety of ways, whether it was management structures, as Cyril suggested, that the top can get disconnected from the front line, or small organisations not being part of a professional network and being out of touch with what good practice is in other parts of the country. Or the horizontal disconnection that Jocelyn highlighted about how staff can be siloed and not understand what's even going on in their own organisation. So a plea, I suppose, to get the NHS more connected up, not in the same vanilla way that every trust has to look and smell the same, but in order to provide that virtuous cycle of learning and improvement. This afternoon we talked a lot about clinical engagement and the way that provider organisations work being key, and that Royal Colleges could do more to reinforce that. And I think we heard the more that the colleges for nursing and medicine can do that as a joint initiative, it will signal the message that we need to build bridges across the professions and between the professions and managers. And then I suppose a final point around that we need to get tighter at the systems for accountability, whether it's a code of conduct or managers being rigorous about getting rid of the people that don't deliver, or whether it's about doctors or nurses, that being systematic about weeding out poor practice seems to be key. suppose a final reflection, it seems to me that well, if we've been talking about culture, we've been talking about culture as the glue that binds an organisation, but also as, just like glue, if it's toxic, it's pretty difficult to get rid of. And the things that kind of help our culture to improve come not only from the top of the organisations, but right from the start of clinical practice, as we get teams to work as proper teams, and not just the sort of pseudo teams that we often see in the way that healthcare is practiced. So those are just some of the themes that seem to me to be bubbling around what we've been talking about today.
Well, thank you, Sarah, and thank you to all our speakers who I think have been provocative in some cases, inspirational in many. These seminars have been a liberating experience for me for two reasons. One is that I can stand up and walk around rather than sit in a chair all day. And secondly, to listen to groups of people like yourselves contributing your wisdom is very helpful. So it's of enormous benefit to me, these seminars, whereas, of course, seminars are meant to benefit the attendees yourselves. But I hope you will go away with at least some benefit. Perhaps, therefore, I could leave you with a thought, which in part is been predicted by Anthony, who stole my line in revenge for me stealing his. But he referred, as I did at the last seminar, to the anger that the public feel. And I have felt that anger almost physically by having to sit for 3 weeks during my first inquiry. The sessions went on longer. But listening at the rate of 3 families a day tell me about the stories of their loved ones and how they died in Stafford Hospital. And for me that was a transforming experience, although I have spent my professional career quite often listening to individuals, incidents of that nature, and then that is in the litigation context. I think there's a message there, which is that the stories that are told need to be used, and the people who tell them need to be listened to, not only by those who have directly responsibility for affecting them in that way, but everyone in the system. But there's another factor of the anger which perhaps I didn't mention last time, and it is associated with the other observation we hear, that Mid Stafford is or might be, if not an isolated case, one where there's been a virtual storm of things going wrong. But after the first inquiry, I spent some time talking to various groups of board members and chief executives and so on all over the country, who would probably have described themselves as the worried well of the NHS. And various comments often came out. One was, there but for the grace of God. And the other one was, I'm sure something like that is happening in my place. The confidence, or the blow to confidence that Stafford has caused, I think is immense. But one thing that can be learned to prevent complacency is that, as we've heard today, there is, I think, no place for being complacent because 98% of the time you're not infecting your patients with MRSA or whatever it is. That cannot be acceptable to the public. The other point is this, that a loss of reputation is contagious. One of the reasons the General Medical Council and other professional bodies act harshly in relation to people who step over the mark is to maintain public confidence in the rest of the profession who are actually doing their job correctly. And I think there may be a case for saying the same needs to apply to the health system as a whole. Therefore, bad practice in one place is something which actually affects the reputation of the whole, and therefore it is something that affects everyone and impacts on them, even if they personally are doing a good job. So that's true from ward to ward, from department to department, from hospital to hospital, and different aspects of the health service to other parts of the health service. So it probably means, and I'm sure you will accept this, that everyone, whether they think they're doing a good job or not, has a duty to root out the bad practice everywhere, wherever it is. And it seems to me that maybe a message coming out of this seminar and some of the others I've had is that at least that's a starting point for a change in the culture. But thank you very much for today, and I hope you, as I say, I've got some benefit out of this, as indeed have I. Thank you.